On behalf of NYU School of Global Public Health, welcome. My name is Rachel Harrison, and I'm pleased to introduce Dr. David Abramson and Dr. Alexis Merjanoff of the NYU Center for Public Health Disaster Science. Tomorrow marks 10 years since Superstorm Sandy made landfall in New Jersey. Many of us clearly remember the immediate aftermath in New York and New Jersey, the destroyed homes, flooded subways, hospital evacuations, gas shortages, and long power outages. So how are the most affected areas faring a decade later, and how does their recovery compare to other major storms? Dr. Abramson and Dr. Merjanoff sought to answer these questions in the new report released today. I've put a link in the chat so that you can view it. The report builds on their earlier research studying the long-term recovery of areas affected by Hurricane Katrina, Hurricane Sandy, and other natural disasters. I will now turn it over to them to discuss their findings, after which they'll be happy to take your questions, which you can put in either the Q&A or the chat. Dr. Abramson.
Thank you very much, Rachel. Good morning, everybody. Alexis and I are both part of the New York University Center for Public Health Disaster Science. And this report builds upon work that we've done over the past decade on Hurricane Sandy. We did a major longitudinal cohort study known as the Sandy Child and Family Health Study, which was done in partnership with Rutgers and Columbia University and funded by the New Jersey Department of Health, and involved a random sampling of 1,000 households in New Jersey. And we've also done work looking at public health impacts of Sandy on public health infrastructure. So what we wanted to do this time at the 10-year mark was really understand what were the systemic effects. And beyond that, we wanted to create a template for how to measure recovery after any type of disaster. And our thought was to look at data that would be publicly available, universal, standardizable, so that we would be able to compare the effects of one event to another. It was also important to us to look at a couple of key recovery domains. And this is something that has built upon work that we've done after Hurricane Katrina, where we've run a longitudinal cohort study there as well. And the domains that we think are critical to look at include housing, education, economics, and social health, obviously, and social and civic engagement. All of these are part of what we think of as the socio-ecological model of disaster recovery. And there are several key principles when we look at disaster recovery, particularly long-term disaster recovery, which many people don't really pay as much attention to as they do the drama of the immediate impact. So the key features of long-term recovery that we've researched over the years is this notion that there's a dose-response effect, that the greater the dose of disaster exposure, the longer the period and the more profound the recovery challenges are. Secondly, that there's something about the strength of formal and informal systems, whether they are governmental response systems or their community level systems, that can help buffer or mediate the effects of a disaster. Number three, that those things which have occurred in somebody's life before the event have a huge impact on how well they can recover. So you have to pay attention to the vulnerabilities of the population before the event. Number four, that individuals are part of a much larger system. They may be part of households, be part of communities, but those communities themselves are part of larger systems. And lastly, that recovery itself represents a return to some sort of equilibrium, or maybe to even a new status where somebody is doing better than they are before. And so one of the elements that I mentioned is the fact that people are part of larger systems. So this time we wanted to look at really large systems. And in fact, for our report, we looked at the systems of the most heavily impacted counties in New York and New Jersey. And so we took as our starting point the FEMA Modeling Task Force, which reported upon the most heavily impacted counties in the two states. And there are 9 counties in each of the states that we focused upon, including the boroughs of New York City. And so what we've done is we've looked at things such as unemployment and poverty. We've looked at gross domestic product per capita. And then within each one of these domains, we've looked at 20 years of data. So we've essentially taken the point of the hurricane and its impact as, one point, and looked 10 years prior and 10 years after that. And some of the things that we've seen show an reasonable amount of resilience in these large geographic regions. So, for example, we saw that unemployment rates were essentially not really affected by Hurricane Sandy. They were more affected by the recession that preceded it and COVID-19. And so that kind of large-scale economic trend suggests that it's only these major systemic disruptions, perhaps, that can have systemic effects. But I'd like to share my screen for a moment and show you one thing that we discovered that I think is a useful way of considering economic impacts. So this slide is showing, and it's in the report as well, is showing just for Manhattan alone, the GDP per capita of 3 selected sectors. One of them, the financial services sector. Secondly, the information and cultural products sector, which includes media, publishing, internet, data processing, and then the real estate sector. And you could see with the gray bar, the Sandy timeframe right there. And so by far, the financial services sector is the largest of any sector in the metropolitan area. And it tends to buoy everything around it, both in New York and New Jersey, since so many people are somehow connected to New York. The sector itself, at $100 GDP per capita, is a good 50 times greater than other sectors such as manufacturing and construction and the services sectors. What you see here is that there actually is a little bit of a depression from during that period of Superstorm Sandy on the financial services sector. And yet there was no comparable depression on the information sector, or if it was only a fairly modest one. So we think something like this really reflects several different things. One, that Sandy did have an effect on the financial services sector broadly. We know that there were foreclosures, that the housing market, took a brief dip, but it was only brief. So the sector essentially was able to rebound, and also that overall, it's able to carry all these other sectors along with it. Because when you look at the overall financial stability of the New York metro region, it remains fairly stable. The other thing that we found that was revealing is we compared the impacts of Sandy on deaths of despair, which are deaths that occur due to alcoholism or drug use or suicide. And interestingly, we didn't see a large effect of Sandy on the local deaths of despair in these 18 counties, but we compared Hurricane Sandy to Hurricanes Katrina and Harvey. And this is part of our intention to begin to show comparable events, comparable disasters, so that we can begin to try and generalize about recovery. And so in this case, we found that only in Hurricane Katrina was there a spike in deaths of despair after an event. So at the end of this effort to look at these systemic effects, there are a couple of things that occur to us. Number one, that it does take a systemic disruption to create a systemic effect. Number two is that, you can't necessarily assume that because there were no systemic effects, that there weren't individual level effects. This is something in public health that's known as an ecological fallacy. And it's really a key way of thinking about this because um, it's entirely possible that even on a single block, there can be differential effects from a hurricane or any kind of a hazard where some people are greatly affected and others not so much. So when you're starting to look at data at a county level, it sometimes mutes the individual level effect. Number three, um, the the fact is this is a high performing area with fairly effective governance. And so it as systemically and structurally, this is an area that was well positioned to be able to rebound from an event such as Sandy. But good fortune does not necessarily equate good planning. And so as much as we were fortunate that we've been able to recover, there was definitely a significant, substantial impact of Sandy on the region. There was a $26 billion investment from federal agencies into these 18 counties, and the money is still being spent today to continue to rebuild. There Another aspect is that pre-existing disparities continue. So when we looked at racial ethnic disparities, and you'll see this when you look at the trends in the report, they continue unabated. And those kind of social vulnerabilities and inequities still drive a lot of outcomes. And what we know from much of our prior recovery work, those are the aspects that really often determine whether people recover quickly or at all. And then lastly, there are different ways of looking at recovery. We think of it as the hammer and the scalpel. The hammer are these large scale economic trends. The scalpel is where we look more discreetly at individuals and how they've recovered. So there are two ways of thinking about recovery, these big systemic effects, but also individual level effects. And for those, I'd like to turn the microphone over to my colleague, Alexis Mergenoff, who's going to talk more about those individual level effects that we've seen.
Thanks, David. So in tandem with this report, we spent the last 3 months or so collecting interview data from some of our respondents from the Sandy Child and Family Health Study. We conducted interviews with 25 older adults, so people who are currently 65 and older, who are living in southern New Jersey, mainly 4 coastal counties, including Cape May, Mammoth, Atlantic, and Ocean counties, and talk to them about their recovery, what has happened over the last 10 years, how it has impacted their ability to age well, their perceptions of climate risk and future possible future storms, as well as their decisions to age in place, how they've made those decisions to stay in New Jersey after being exposed to Hurricane Sandy, and in many cases experiencing high levels of housing damage and other forms of direct impact from the storm. On a whole, people are doing pretty well, but it has taken a very long time for our respondents to recover. They've encountered issues related to insurers providing timely resources back to them to rebuild their homes. Many encountered contractors who took advantage of them, which were, several reports after Sandy, we heard about that. And lots of thought going into how their neighborhoods and communities have changed since Sandy. And a lot of this relating to the overdevelopment of coastal areas that they've seen and their concern for their communities and their neighbors. And they've noticed changes to their environment, coastal erosion, more frequent flooding, So they are acutely aware of the changes that are occurring in their environment, and yet they are so attached to their homes and neighborhoods and the identity of being a resident of coastal New Jersey that that they think that it's worth staying. So we had several respondents who were able to speak to the importance of being by the beach, of walking, taking long walks, of being in tight-knit communities, and all of these aspects really help facilitate recovery as well. So I'm happy to speak more to any of those findings, especially as they relate to the broader findings from the report, and talking more about individual level recovery.
Thank you so much, Dr. Abramson and Dr. Merchanoff. If anyone has questions, feel free to put them in the Q&A. We'll start with one from Matthew at Newsday. If the researchers could speak specifically about the paper's findings in Long Island counties, like Nassau and Suffolk counties.
Right. So one of the ways that we've approached this is to treat all of these counties as essentially two different systems. So for the moment, we've got a New York and a New Jersey system of highly exposed counties. And so for the report itself, what you'll see when you look at the graphs is that we've aggregated all of the effects into, a single trend line for all 9 counties in the New York area and then all 9 in the New Jersey area. And what we're doing now is we're following this up with a secondary analysis that we'll be producing another report that is looking more specifically at counties within to see how the counties have varied. We have noticed already that in New York, there were, and this is going to be no surprise, is that there were 4 counties that were hardest hit, even amongst those that were hardest hit. And those were the ones that were on Long Island, including those 2 that are New York City-based counties in Long Island. So it was Brooklyn, Queens, Nassau, and Suffolk. There are differences even in the amounts of investment. So one of the things we have is we have a table of federal funding that went to each of the counties. And it's useful to see that, for example, Suffolk County had about 83 million in FEMA individual assistance, whereas Nassau County had 336 million, or essentially 4 times as much individual assistance. And that often goes to homeowners and to renters directly. From work that we had done with a lot of the public health agencies in Nassau and Suffolk, we were well aware of the impacts on those 2 communities, Nassau in specific, where there were major problems with wastewater systems. The Long Beach area took a long time to recover. We did see that there were spikes in building permits in particular in these areas. So obviously there was a concerted effort to jumpstart building and reconstruction that was pretty much a 2 to 4 year process where that peaked after the event. I think it's been in line with most of the region, which is within 5 years. Most of the major reconstruction had occurred, but there's a long tail where there still are some homes and some infrastructure that is still being addressed, and mitigation that is obviously still occurring. But I would say, look, keep an eye out for our next report on the county-specific analyses as well.
And a follow-up on that from Matthew, was the aid inconsistent with the need on Long Island?
That's a good question. We did notice throughout our work, both with the Sandy Child and Family Health Study and qualitative work that we've done, that a lot of times people left money on the table because they didn't trust government. They didn't trust contractors. And despite the efforts of government officials to help people be able to navigate these very complicated systems, people would not apply for them. And so it's entirely possible that there's a large proportion of people who ended up either giving up trying to get the funds that were available to them, or elected not to get them at all because they were concerned about being ripped off. And there was some merit to those concerns. I mean, Alexis can speak to the fact that some of the folks she's talking to now as part of the Aging in Place study have described efforts or instances where people had money, fraudulently taken from them by contractors.
And one more follow-up along those same lines: was the aid proportionate to the need? In particular, Suffolk got so much less than Nassau County. Do you have any sense why and what to make of that?
Yeah, I mean, I would say that it probably has something to do with the numbers of homes. I don't have the exact number that were destroyed in each area. I think there might have been more housing destruction in Nassau than Suffolk. It may also have to do with housing value property and the property values, which is also going to, distinguish why that number is so much higher in Nassau than Suffolk. There was also, by the way, federal public assistance, which goes towards a lot of debris removal. And I mean, I recall, because I was there, having seen lots of debris removal in Nassau County around, the sand that had washed the shore. And I think that was maybe a little bit more profound than in Suffolk County.
Another question, can you talk a little bit more about how the recovery from Sandy compares to past disasters? You mentioned about deaths of despair related to Katrina, but you've both done quite a bit of work related to the aftermath of Katrina. I know that the team published research about time to getting back into a home after Katrina. If you could talk a little bit more about how Superstorm Sandy compares to others.
Alexis, do you want to first handle the question of time to stable housing after Katrina?
Sure. In a previous study, we found that residents who were displaced by Hurricane Katrina in both Louisiana and Mississippi, that it took them on average slightly over 3 years to find stable housing. And you can imagine the amount of uncertainty that kind of encapsulates those 3 years that people are moving frequently and trying to find stable housing. In terms of New Jersey and our work on Hurricane Sandy immediately after the storm, we found much lower rates of displacement, but still, especially in the southern portion of the state, still high impact in terms of lots of home damage. But we have always talked about Hurricane Sandy as more of a middle class disaster. And so the people who were impacted, oftentimes had resources to recover. They had access to financial resources, they had flood insurance, they had homeowners insurance, their communities were well resourced. And it really speaks to the importance of having a robust social infrastructure in place before an event occurs. New Jersey did a lot of work beforehand, before Hurricane Sandy hit, looking at what happened during Hurricane Katrina and trying to say, what can we do to ensure that people of our state don't experience something like that? And so there was a lot of effort that was put in at the front end, pre-event, and then once the event occurred, once Sandy happened, there were plans in place, and as David mentioned, there were lots of recovery programs and lots of money left on the table. And that's not because people didn't necessarily need it, but because most of the impacted population was middle class. They either assumed that they weren't eligible or didn't know how to access it. And so, the recovery was, I'd say on a whole, faster with Hurricane Sandy, but it has a lot to do with the investments that were made to both the physical and social infrastructure within the state of New Jersey.
The only thing I would add to that is having spent a lot of time down in the Gulf Coast after Katrina, as well as on Long Island in New Jersey and New York City after Sandy, it was pretty striking, the difference in terms of the debris and the destruction and how long it lasted. It's easy to recall 3 years after Katrina, still walking down the streets and seeing homes that were completely demolished and people's personal effects still strewn around the neighborhood 3 years after the storm. And that was definitely not the case after Sandy. There was a concerted effort, and I agree with Alexis that there were definitely lessons learned by the local municipalities and governments about the advantage and value of clearing that immediately or as fast as you can, because it gives people a sense of hope that there's an opportunity to rebuild.
Any further questions? Well, with that, I want to thank everyone for joining us today, for your interest in this new report from the NYU School of Global Public Health. If you have any follow-up questions, please feel free to reach out to me or to the researchers. And we appreciate you joining us today.